and don't have to treat everybody. Example, how many ophthalmologists today actually do a refraction? It was once upon a time, it was bread and butter. Similarly, you have to think an idea that how do we distribute people, because with 101 million people diabetes in the country, 136 million undiagnosed diabetes, 236 million. So how do you handle this? So I think it's a question of time when we'll go to doctor. Supposing like you have done, we have done that, go to the, instead of building a large tertiary hospital, go to a secondary, primary hospital, then go closer to people. Most probably this is possible, maybe in next 10 years' time.
Yeah, and probably just one line from the person who prescribes the medicine to the patient for diabetes, go see an eye doctor. So that itself transfers a little bit of responsibility for patient to find. Thank you, sir.
So am I allowed to run away?
Yes, thank you so much.
Okay, thank you, Dr. Das. So the next talk will be a pre-recorded talk by Dr. Peiquan ZHAO from China. The talk, its topic is potential hazards of low-level red light therapy in myopia. You can play the video. Thank you.
I'm honored to be invited today to share my topic on the potential hazards of low-level red light therapy in myopia. There is no conflict of interest. Myopia has been a huge burden in Asia, especially in East Asia. It is predicted that by 2015 there will be about 5 billion people with myopia and 1 billion people with high myopia. Myopia brings further vision challenges because high myopia increases the risk of pathologic ocular changes such as cataract, glaucoma, retinal detachment, and myopic macular degeneration, all of which can cause irreversible vision loss. The situation is very serious. Parents, patients, and doctors are very concerned. We want to prevent the development of myopia and to slow its progression. Of the many strategies, repeated low-level red light (ILRL) has emerged as a popular yet controversial option. For the past 3 decades, ILRL therapy has been used in China as an alternative treatment for amblyopia. Despite the lack of conclusive evidence of its efficacy, in recent years, IL has been repurposed as a novel approach for myopia treatment and has seen increasing use across the population. There are more than 10 commercial brands of ILRL devices commercially available in China. ILR therapy directly exposes the eye to a laser with a wavelength of 613 to 650 nanometers. The 3 minutes exposure is scheduled twice a day at an interval of at least 4 hours every day, or on weekdays for at least 6 months. Its mechanism remains unknown. It may prevent axial length elongation through sinking the choroid and increasing the choroidal circulation. There are international standards regulating the classification, hazard, and safety controls for laser products. Class 1 lasers are low-powered devices that are considered safe from potential hazards. Class 2 laser products are described as low power, less than 1 milliwatt, visible light lasers that could possibly cause damage to the eyes. Class 2 devices require additional controls to ensure their safety and effectiveness, but the clinical trials are not strictly mandated. As for laser products with laser power of 1 to 5 milliwatt, they should be classified as class 3 and should not be aimed at an individual's eye. Published studies using ILR therapy reported that the devices are class 1 or class 2 laser products. For example, the light power entering a 4 millimeter pupil of this device is supposed to be about 0.29 milliwatt. Then it is classified as class 1, which is at a level considered safe for direct ocular exposure that would not create retinal thermal hazard. There were several well-designed randomized controlled trials in China that showed this effect for myopia control. This clinical trial was published in JAMA Network Open in 2023. The primary outcome was the incidence rate of myopia at 1 year follow-up. The RLRL intervention significantly reduced the myopic shifts in terms of axial length and SER. For patients with high myopia, the IRR also demonstrated stronger treatment efficacy, with half of the participants experiencing substantial axial shortening. Due to the widespread use of IRR for myopia in the market and hospitals in China, a Chinese expert consensus was introduced in 2022 to regulate the application of IRR therapy. However, we have seen two cases of retinal damage after IRR therapy. Case 1, a 12-year-old female presented with bilateral vision loss for 2 weeks after 5 months application of IRR laser exposure for bilateral moderate myopia. The patient complained of abnormally bright light 1 month ago, and after images prolonged after exposure. OCT image before IRR therapy were normal. The BCVA declined from 20 to 20 to 20 to 30 in each eye. Fundus photographs revealed only bilaterally darkened fovea with a hypoautofluorescent plaque in autofluorescence images. After discontinuing IRR therapy for 3 months, in case 1, partial restoration of retinal structure was observed, along with a visual improvement to 20 to 25 in both eyes. Case 2 was a 5-year-old male presented with myelinated retinal nerve fiber and myopia of -8 diopters in his left eye, seeking methods to control the myopia. During the last 10 months, besides RGP, IRR was taken for the left eye. Its visual acuity was 20 to 40. OCT images revealed shallow parafoveal retinal detachment and discontinuity of the ellipsoid zone and the interdigitation zone in the left eye. De novo sequencing did not detect suspicious inherited retinal disease-related gene mutation. After 15 months without IRR, OCT images showed a brokenly continuous ellipsoid zone and a partially absorbed subretinal fluid. BCVA improved to 20 to 33 in his left eye. These two cases demonstrated the potential hazards of IRR to the retina and needed to be taken seriously. Potential mechanisms of retinal damage may be explained as follows. Light with wavelengths is ranging from 400 to 1,400 nanometers can reach the retina, posing a potential hazard. The IRR therapy emits 613 to 615 nanometer laser, so it can reach the retina. Some ocular microstructural changes have also been discovered in clinical studies. This study reported that IRR prevents myopia progression and improves the macular function by examining FERG and contrast sensitivity. However, on OCT, the REZR increased significantly at 6 months. The RPUSR increased significantly at 6 and 12 months, and the increase in RPUSR was greater with greater axial length regression. We are concerned whether prolonged overaccumulation of PUS damages photoreceptors and RP cells. Therefore, further studies are needed to determine whether RPUSR can be restored after discontinuing IRR, and the changes in RPUSR and the structure and the function of photoreceptors and RP cells over longer use of IRR. This study showed choroidal sinking initially after IRR treatment, especially at the subfoveal sector. Another study showed that there was a time-dependent stimulative response in choroidal and retinal circulation. These findings may contribute to axial length shortening, but is the retina and the choroid being heated? These questions remain safety concerns. Moreover, a 2-year post-trial follow-up study of the first clinical trials reported sustained and rebound effect of IRR continued IRL therapy sustained promising efficacy and safety in slowing myopia progression over 2 years. However, the long-term safety and efficacy of IRL treatment are still in doubt. So far, the place of laser product management has been changed due to safety concerns. These laser products for myopia treatment were no longer allowed for production and sale. From July 2024, they were classified as Class 3 medical devices, which should not be applied unless their efficacy and safety were fully proven. We should be the first ones to embrace new technology, but also we should be the first to be hesitant about the side effects. To include, many clinical trials and experimental research in China showed that IRL can effectively prevent myopia and slow its progression. However, non-clinical trials reported results longer than 12 months and no long-term safety data available. It may expose the retina to high toxicity. Thank you.